Yes, yes. Good evening. Hello, world. It's me again. All right. So, is it true that our mouth really reveals what is our health? So that will be our topic for tonight here at Kapet Pandesal Go Live. And with us tonight is Clover Medical Center. I am B, your commentator for tonight. And we are back, and this is going to be a very interesting topic with me, a very beautiful dentist. I don't know exactly how will I call her because I thought she's a model. Right? So please welcome, without any further ado, Dr. Neha Sandev. I don't know really if I pronounce it correctly.
I'll introduce
myself. Yes,
myself.
please do introduce yourself.
Hi, hello everyone. My name is Dr. Neha Sachdeva. I work as a GP dentist at Clover Medical Center. I'm also a gum specialist in the center.
All right. So everyone, please do share our live tonight so that we can reach out to our kababayans especially. And this topic is really for you tonight here at Clover Medical Center. Nahda. I am here in Nahda, very near to my place.
Yes.
Yes.
If you have any questions, you can please ask during the review and I'll be very happy to answer them.
Yeah, and I have some notes, of course, because this is not my specialty at all. So
it will be after today's
Yes. So Doc, shall we start?
Yes, yes.
All right. So Doc, this is one of the most important questions nowadays. Especially, we need to really discuss this about the sign and symptoms of oral condition. And what is this oral condition that we are talking about?
Alright, so patients come to us with a lot of dental problems. One of the very important ones is bleeding gums. A lot of patients come and say that when they brush their teeth, their gums bleed. So there are a lot of causes for bleeding gums, but the most important one is if you have a lot of tartar or plaque stuck to your gums, which is also called as gingivitis. I'm sure you know
so tartar and
plaque. So what
plaque.
happens is that the plaque and tartar, which gets stuck onto our teeth because of maybe improper brushing, has a lot of bacteria in it. That bacteria is in very close connection to the gums. So that can cause swelling and infection of the gums. So the gums become very sensitive and swollen. The moment you touch them, even when you brush them, they start to bleed. So that's when it's a bit scary for the patients too.
Yes,
Nobody likes blood in their mouth.
If you're brushing your teeth, but just suddenly some blood just coming.
Yes. But the good thing is that it's very easy to treat this problem. So if the patients come to us with bleeding gums, most of the times the problem is plaque and tartar. If we remove plaque and tartar by doing a dental cleaning and polishing, most of the bacteria goes. Therefore, the gums automatically become better and they stop bleeding.
Oh, wow,
Yes,
that's very interesting. I know. I have lots of knowledge now. Yeah, because I usually heard about the tartar and all. How does this tartar really is forming? Is it coming from the food that you eat or proper way of you're not brushing your teeth at all?
Yes. See, now when we brush, right? Like how much? You tell me. For how long do you brush your teeth every morning?
Oh my God, this is scary. All right. So actually, Doc, in the morning when I woke up, I brush my teeth and also I use
You use
Tubercle and all.
Yes.
And then
I don't want to put you in a spot.
Yeah, it's like 3 times.
That all of us, when we wake up in the morning to brush, we're always in a hurry to go, right?
Yes.
We have to rush to work.
Yes.
So most of us brush really quickly, like maybe like in a few seconds. That's not what you should do, right? You have to spend good enough time brushing. You have to give it its time, minimum of 2 to 3 minutes. You have to cover all the areas in the mouth. So you have to brush the upper teeth, the lower teeth, the upper side, the side areas. All the areas have to be covered while brushing, and it takes a good 2 to 3 minutes to do that.
OFWs are not doing that because we are all in a hurry.
We're all in a hurry in the morning. So make sure you allot good enough time for brushing and you cover all the areas and brush them well. so you will not have any tartar or plaque stuck. Also, obviously, like you said, one time is not enough. You have to also brush before you go to bed at night. So if you do all of those things, there will be no tartar or plaque, or very less, not enough to cause so much problem. And you can always come every 6 months for a cleaning. Your teeth will be as healthy.
That's very important, because you know what, we have really a big problem in the Philippines when it comes to really brushing our teeth and all, because you know Philippines
it's not just there, it's everywhere.
Yeah, everywhere. So everywhere. So like people really don't go to the dentist like 6 months and all. It's like never at all until they have this problem now in their mouth.
Yes. See, the thing about dental disease is that if you catch it at the right time, it's easy to treat. Like if you have initial stage of gum disease, you clean it and you're done. If you have initial stage of cavity, like a small cavity, you fill it and you're done. But if you wait till the problem becomes bigger, then the treatment becomes bigger. The time that it requires to treat becomes bigger. The cost also becomes bigger.
Yes.
You know? So best to come for regular checkups so that we can spot the problem early and treat it early before it gets worse.
Yeah. So here we have, Elton is watching right now, and some of the guys are just watching because they cannot comment at all. They are still at work but listening at the metro as well. So guys, just share this video to your friends and family and colleagues that you think that they need to have this information. So Doc, I have here also one question actually. They said that some people are having really a white teeth and some are like yellowish. Is there something about
Alright, see, I know everybody wants white teeth, right? But the normal natural color of our teeth is yellowish white. It's not white. Okay? So if you have slightly yellow teeth, mostly it's not a problem.
Okay.
But there can be some, calcification problems of the teeth that can make it a little more yellow. But usually, slight yellowish teeth are normal. They're not bad. But these days we have many ways to make them whiter if you want, but purely for cosmetic reasons. You know, it's not a disease to have yellow teeth.
Yeah, because
some
people are so shy to really smile. Like me, I don't have really a really white teeth, but this is my normal teeth, the yellowish teeth. Now I know with the doctor it's normal.
It's normal.
Yeah.
But yes, we do have something called as bleaching and smile. These days we can do a lot of cosmetic treatment for our teeth that can make them look whiter and brighter and nicer.
Yeah, especially for all my friends out there who are doing blogging in social media. If you're a host and like that, you're into a public speaking, celebrities, and you are really mingling.
When you have like the light focused on your face, like
so
now.
You need to have really a nice white teeth. So doctor can do that for you, right, doctor? The cosmetic things. Okay, doctor. Here also they are saying that bad breath. What can you share about the bad breath? So we are really encountering this bad breath thing.
Yes. A lot of patients do come to us with a complaint of bad breath. Now there are multiple reasons why a person can have bad breath. Okay, one of the most common one is bad teeth, or the same what I mentioned, tartar and plaque on the teeth, or cavities on the teeth. Okay, but one thing that we all ignore and is very important is the tongue. We have a lot of bacteria sitting on the tongue producing bad odor substances that can lead to bad breath. Okay, so therefore tongue cleaning is very, very important to prevent bad breath. You get your teeth cleaned and you brush properly, but do not forget your tongue cleaner.
Do we need to brush also our tongue?
You can.
Oh, yes.
When you go to the market, there are different types of tongue cleaners available. You can use those, or you can have a separate soft brush just for your tongue. So every day after brushing, take the brush and brush the most back part of your tongue as much as possible, and then you clean your tongue. It's very, very important to get rid of the bacteria on the tongue if you want to get rid of bad breath. And obviously sometimes bad breath can be because of smoking and dry mouth and all, so have lots of water, don't have bad habits.
So when we talk about bad breath also, smoking is really a big factor.
It is.
So if you're really smoking, you need to have most importantly, you're the person, you need to have really a good hygiene with your brushing your teeth and your tongue as well,
Yes.
the doctor said. Alright, so we have here that is here. Oh, this is very informative and educational. Thank you, KPD, for always featuring topics that are both practical and relevant. And thank you so much, Clover Medical Center.
That's sweet. Thank you.
Thank you, thank you. And please do share. And if you have some other questions, you can just write it down and I'm going to read it. And the doctor will answer it. Yeah. So, doctor, how young a child can start brushing their teeth?
Oh well, for kids, as soon as they have their first teeth in the mouth, they have to start cleaning them, you know. You don't have to wait for all the teeth to be out.
Yeah.
So when they're babies, even when they're like the teeth start coming in very early, when they're 6 months, 7 months, at that time itself, whatever teeth are out, the parents have to make sure that they clean them. And also regular visits to the dentist or to the child specialist dentist must start early.
Yeah, because some of the kids are so scared about the dentist when they go to the dentist, like they are already 7 years old. So I think this is a good training when they started.
Because you know, one very important thing about dental problem is that it's preventable. If you take good care of your teeth, nothing bad will happen most of the times. So if you visit your dentist sooner, he can tell you what to do, what not to do, so your baby or your kids don't even develop any dental problems. Like, you know, there is like, for example, a lot of patients get cavities because they have milk bottles when they're sleeping. So baby would be sleeping and they would have the bottles with milk, they'll feed the babies and they just leave them there, you know. So the whole night, milk that has sugar in it is in touch with the teeth. And then that leads to a lot of damage to the teeth. So if you meet the dentist first, you will know about all these things beforehand. So you will not make any mistakes while, like, you know, feeding the baby or while giving them snacks or, you know. So it's very important, regular checkups and meeting the doctor at an early age.
Yes.
Also, you need to make sure that the child is used to going to the dentist. The child should not be scared of the dentist.
Yes.
If you take them at an early age, you know, because at an early age, they will not have any dental problems. So they can come, say hello to the dentist, meet the dentist, take their toys and go. So it will seem like a happy, friendly place for them. They would want to come back, you know.
Yes.
But if you come with them at a stage where the teeth are in a bad shape and then where we need to do some treatment that will make them uncomfortable, it's going to be difficult.
Yeah,
So
it's
then,
very hard. So I'm going to talk in Tagalog. So mga kababayan natin, if you have kids, children, so you need to start early really of taking good care of their teeth. And please, same like visiting a doctor. So let them be.
And milk teeth are important. Don't feel like, oh, they will fall out and there will be new teeth coming in.
Is it? Yeah. What about that?
So
It's like a baby teeth, they're saying. So
yeah, baby teeth are very important because if your baby teeth has severe infection, it can be passed on to your permanent teeth as well. Okay, and if your baby has an infection in the tooth and you end up removing a tooth before its time, then there might not be enough place for the new one to come in the mouth because the other teeth can move to take the place, you know. So it's very important to treat them, to keep them in the mouth for as long as they're meant to be, so that they don't fall out or they're not removed prematurely or before time.
yes, so very important. Now I'm going to read some of the comments here. I tried the service in Clover Medical Center and I can truly say that I recommend their center because their medical attendants are very able and friendly.
That's so
All
sweet.
right.
Guys.
Well done,
Thank you.
Dr. Neha from Manas. Ayan. Shout out to Sir Richard. Also, don't worry, Richard will be joining us later on. And then here, there is one question from Mr. Elton. When brushing should we have to do it harder to make it a good one? What he's trying to say is when you brush, is it really hard brushing?
No. So that's the mistake a lot of us make. We feel like the harder we brush, the better it is. But it is completely untrue. Okay? Sometimes if you brush too hard, you end up scraping away or, you know, abrading the upper part of the tooth itself. So it damages your tooth and it damages your gums. And you can have gum recession. Your gums can go up. You know? So brushing is important, but don't overdo it. Don't overzealously brush. Don't scrub your teeth like that.
Yes.
Brush with a soft brush. Brush up and down. You know, avoid scrubbing too hard because it will damage your tooth and your gums.
Maybe you are just brushing your teeth because you're broken-hearted. You can also visit Clover Medical Center because they have doctor also will treat you with your heart problem.
Oh well, I don't know about that.
Yeah, see, because there is also specialist in that with the heart. Okay, so guys, once again, as Dr. Nahda said, so brush it like, so you know what, like taking good care of your face as well. You do need to really scrub it
Yes,
so hard.
You don't have to scrub
So
hard.
it's like, you
Yes.
know, treat it like a diamond thing. So what else can you share, Doctor?
Be gentle while
yeah.
you're brushing. When you're brushing, make sure that you brush, like I said earlier, at least 2 times, or if you want even 3 times, brush gently.
Yeah.
But very importantly, also try and use floss.
Okay. So like this one.
Yes. So now brushing can remove tartar and plaque from the the outside and the inner surfaces, but sometimes things or plaque can get stuck in the in between.
Yes.
Okay.
Especially when you're eating.
Yes, so in between the teeth, and in between the teeth, then you have to use a floss.
Yeah.
It's like, I'm sure everybody knows what a
Yes.
floss is, like a thread
Yes,
that
and
you
you
can put
do.
in between the teeth and then, clean that bit of the teeth also. If you have gaps in the teeth, they have something called an interdental brush. It's like a mini water brush kind of thing that is going to the spaces in between the teeth. Very important, because in between the teeth, the normal brush does not go. And if you don't clean them properly, then it can lead to cavities and other problems. So, proper brushing.
Yes, alright. So we'll be right back after this short commercial break, and later on also Richard will be joining with us. So let's go to a commercial break. And we are back. Now we're going to the other part of this really informative discussion with Dr. I would like to call her Miss Neha because this is so pretty. Why all the dentists who are also working in they have a really nice Okay, Doctor, yeah. So let's proceed with the Clover Medical Center, especially here in Nahda.
Yes.
What are the other services that we can give to the community, especially?
All right. Clover Medical Center, we have a lot of dentists working with us. We have all the dental specialities under one roof, so that's one benefit. If you come here, you don't have to go to any other dentist because we have a root canal specialist, we have gum specialists, we have surgeons, we have braces specialists, we have child dentist specialists. So all specialists under one roof, and those are mostly all the specialities. Also cosmetic dentists.
Yeah, all right. So some question also here just came in to my messenger because she's having a problem with her tooth, and the doctor informed her that she needs to have a root canal.
Okay.
Oh my god, this is so painful, right? I want to try this. Why people are ending up of doing this root canal? Why?
That is because, like I said earlier, you have to get checkups done regularly. So root canals happen if a small cavity is not treated on time and it grows bigger and reaches the nerve of the tooth.
The nerve?
Yes. So if the cavity reaches the nerve of the tooth, you have severe excruciating pain. That's when you come to the dental clinic, and then we advise to do a root canal, which is essentially removing the nerve and cleaning the area and filling the cavity, filling the roots of the tooth. So to avoid that, you have to get regular checkups done, and if you have cavities, just fill them. Get them filled. Clean them, get them filled. Do not wait and say that, oh, I don't have pain now, so maybe I can leave it for later, or I can do it when I have any trouble. So even if you feel like some food is getting stuck in the mouth somewhere, if you feel like your tooth has a black spot.
Yeah, that is
or
actually
like-
the next question. How will I
Yeah.
know if I'm already having those cavities?
Yeah, you have to go to the dentist. They can tell you, they can check and tell you best, because small cavities sometimes patient has no symptoms.
Yes.
You will have no pain, nothing, you know. So the best part is to go to the dentist, let them check out if you have any cavities or not. Also be aware of any black holes or something on the mouth. And also if food is getting stuck in between teeth, that's also a sign, you know, because food can get stuck in between. If you have a hole in that area or a space in that area which is created by the cavity, it will go there. And then, you know, these are the things that should ring alarm bells.
Then you're going to have a bad breath.
Then you can have bad
Yes.
breath.
So can you just imagine people are just turning because you're having a bad breath. So, all right. Anyway, this another question here. So, doctor, why people are doing some braces in their teeth?
Okay. Braces. I mean, as you all know, braces straighten your teeth, right?
Like if you
If you have malaligned teeth, if you have teeth that are not straight, you can get braces. There are various type of braces these days. We have metallic braces, we have ceramic braces, we have Invisalign, which is just almost invisible, and you know, you can get your teeth straightened out. Sometimes, you know, it's not just about the looks. Most of the times, actually, if you don't have a proper bite, it can harm your jaw, it can harm your muscle. So there is more to braces treatment apart from just the cosmetic bit of it. Okay. So yeah, and braces can be done in any age group now.
Okay.
There is no limit. Obviously, like you have to start, you know, getting checkups done at the age of 7. That's when they say you should get your first braces checkup done. But the kids can get it, but even these days adults can also get braces. Not a problem. As long as you had healthy gums, healthy bone, anybody at any age can get their teeth fixed.
It's very painful
Or
actually. On the first week, it's very painful because you know what? Because it's really, correct me if I'm wrong, doctor, because it's really doing like adjustment on your teeth.
So what braces do is that they apply small forces or small pressure on your teeth, and then slowly your teeth move to a nice place, right? The good position or the perfect position. But in that time, I would not call it the most comfortable treatment, but you can manage the discomfort, even the pain, the mild pain. If you have like a painkiller for 1 or 2 days, it can go away. You can have something cold like ice cream, it can get better. So there are ways to go around it. There are ways by which you can avoid the discomfort or minimize it at least as much as possible.
And this will not happen if we are really regularly visiting our dentist, right? So you need to go. So we need to have like every 6 months we need to do the cleaning and everything. So just visit the doctor. It's like a normal with your body. If you don't feel because sometimes we just visit the doctor if we are having pain in our bodies, but we don't really go if it's normal.
Yeah.
We don't feel anything. So same thing on how to take care of.
You're right.
And remember this, that our teeth actually is really very near to our brain.
And and see, now recently there are a lot of studies going on where they say that, you know, good gum health is related to diabetes, is related to good heart health and all of that. So you know, the mouth is the mirror of the body is what they say. So just it's good for your overall health, overall being, and not just, you know, it's not just for a smile. It's for your overall health and your
Exactly. Here there is one really nice question. He was asking that he is having a false teeth. All of it, false teeth.
Okay.
Is it really necessary that you need to remove your false teeth whenever you're going to sleep? They are putting it in the water and put it in the fridge.
Yes. See, it's very important because you need to give your gums some rest. The false teeth that I'm sure, like the the gentleman or ladies talking about is their dentures, right? That's why they can be removed. Dentures, they sit on your gums all day. When you eat, food can go in and it can sit there. But at night, it's better to remove them to give your gums some rest. After cleaning them, clean your gums, give them some rest, you know, so that there is not too much irritation because of the denture onto the gums. It can happen and cause like problems to your gums if you wear it and go to sleep. So yes, please do not wear it and go to sleep. Always remove it, put it in water, and then you can wear it the first thing in the morning when you wake up.
So that is really good. Sometimes they are saying it's drama only that you need to put. Oh no, we know that it's really part of taking good care of those post-it as well. Okay, so hi to Fe, she's watching right now and sharing the rest of the. I don't know if you have some. Because I cannot see all our viewers in my phone. Sometimes I cannot see it. Alright, so doctor, can you just inform all the people what are the phone numbers or what are the services?
So,
where can they contact you especially? Are you staying only here in Nahda or you're also?
No, so see all the doctors in Clover, they visit all the branches. Because we have different specialists, so whenever required, wherever you stay, our clinics are very strategically located in 3 different locations in Dubai, so it's not far for anyone, So people in Sharjah or around this area can come to Nahda. We have a center in Bar Dubai, we have a center in Tcom. So we have total of 3 centers as of now, and whichever one is the closest to you, you can visit us. We offer free consultations, especially for you guys.
Yes, thank you.
And I'm sure we have some good discounts on for you guys as well. So you can visit any of our branches. Yes, and the number, the number is put here. But
don't worry, later on
I'll also put it on all our numbers on the the title of the video.
The live, of course. Okay, so anything else that we can share to our community, doctor, on just a simple word or a piece of advice on how they can really take good care of their teeth?
It's very simple actually. There are just a few things to be followed. Brush well, floss well, go for regular checkups. If you do these things, then all the big procedures and the painful procedures can be easily avoided.
So thank you so much, Dr. Neha, and we'll post once again for just a very short commercial break, and joining with us also a very handsome with a very nice teeth and smile, Richard, will be joining us later. So thank you so much,
Thank you guys. Thank you for having me.
Yes! Thank you so much. It's now Tagalog time. I thought I'm going to bleed. No. Anyway, I'm here at Medical Center. Okay, thank you so much once again to Dr. Neha for all those information that she gave to all our viewers right now. And please, once again, do share this live video later on when you go home. Just watch it if you're at the bus or kung nasaan kayo, napa-English na naman.
English na.
Diba?
Tagalog din natin
Sorry, pwede pala mag-Tagalog. Okay, ay kasama natin ngayon, ako naman ang napakagwapa naman talaga with the perfect smile, Sir Richard, Chad, or whatsoever. Ayan, para i-discuss naman sa atin or i-share sa atin kung ano-ano pa yung mga services na meron dito sa Clover at kung ano mga tatawagan number. Yes?
Hello po. Magandang gabi po sa lahat ng viewers ng Kape at Pandesal. So, iniimbitahan ko kayo na pumunta dito naman sa Clover, ang Nahda branch namin. So, located kami, malapit kami sa backside ng Carrefour Supermarket.
Yes, so, actually sa may bus stop siya.
So may bus stop ng Al-Ali Housing.
Yes.
So, sa mga nagbabas dyan, Al-Ali Housing and drop point sa Carrefour, pwede kayo dumaan doon sa likod, may backside nun. Makikita niyo yung logo ng building namin. So, 3. Ito naman po, so office namin is 304. Yeah.
Andun daw sa taas.
304. Ito yan.
Yes! Oo, tama-tama.
So, Sharjah area, ang Nahda area, mas malapit kayo dito. So, mas madaling may mga So, na-meet niyo na po si Dr. Neha, yung gum specialist namin. So, yan, sa mga helpful tips niya, kasi isa sa mga problems na nakikita ko as a nurse sa mga kababayan natin.
Kala ko nga dentist.
Nurse po tayo, nurse. So, nurse po, yan. yung mga gum bleeding. So usually, nagtatanong sila pagka nagpapaklining, nagdudugo yung ngipin nila. So kapag ka po nagbo-brush kayo ng teeth, na kailangan sobrang wag hard, soft lang po, up and down. Kasi usually kapag nagbo-brush ka po ng horizontally, magugulat po yung dentist, may mga scrape yung ngipin mo na kailangan pastahan. So magugulat ko, wala naman ng masakit, pero yung ngipin mo may mga scrape up kasi sobrang harsh.
Oo, ayan. Yun nga yung sinabi kanina ni Dr. Nahda na dapat hindi galit na galit. Akala kasi, totoo, akala natin pag the more harder, the more na nalinis yung ngipin. So mali pala yun.
So kailangan up and down lang, and then yung medium, usually we recommend yung medium. Kapag ang na-damage na, nirecommend nila sometimes yung soft. So sometimes we recommend yung medium lang na bristles, then up and down. Tsaka kapag nag-gum bleeding na po kayo, kailangan na po ng cleaning, so dental scaling and polishing. Kasi usually tayo papalinis tayo ng ngipin kasi kapag yellow teeth, kapag may mga black spots ka lang sumalis, yung papaklining tayo. Pero aside from that, makikita mo yung ngipin mo, sobrang white, pero kapag nagtutubrush ka naman nagdudugo. So isa yun sa mga kailangan din ng dental scaling and polishing.
Importante yan kasi baka naman ang ganda-ganda ng ngipin mo. Yung pala, may problema pa rin pala dahil yung mga sinipin yun.
So isa din sa nagkakos po yun ng bad breath.
Correct.
So kahit na, pag linis-linis ng ngipin ko, infected naman pala yung gums mo. So yun. So yun, kailangan tinitreat namin yun dito, may x-ray kami. Kasi pagka, usually may mga cases tayo for kabayans na...
Ano ang kadalasan sa kababayan natin?
Yun usually, yun nga usually nakikita ko yung gum bleeding. So like 70% ng mga kabayan na nagpupunta sa clinic namin, yung na-notice ko po yung meron silang gum bleeding. So meron kaming gum specialist dito. So kapag kailangan kasi matreat mo ng aga yan, kasi meron tayong mga cases na kapag late mo na siya, kasi progressive siya, hindi mo siya namamalayan kapag napabayaan mo siya in years. Meron kaming cases, some cases na napabayaan nila, we have to remove the tooth because it's shaking na. Yun. Kasi
tinanggal na yung mga ngipin.
Kinanggal yung ngipin kasi bumababa po kasi yung bone doon sa kapag nag-infect. So yung tooth mo mag-shake. So yung mga common problems na nakikita namin. So kailangan ng x-ray. So kailangan mo ng consultation. So consultation naman sa atin sa mga kababayan nito is free naman. So wala ka naman babayaran doon. And then for Kape at Pandesal, pwede kayo mag-reach out kila ma'am. So meron kayo makukuha discount. Sabihin mo lang na nakita sa Facebook Live. And then recommend kayo ni ma'am. So mag-reach out lang kayo.
So thank you of course to Clover Medical Center. Kasi malaking ano yan. Kasi yung ibang mga insurance actually hindi nako-cover sa mga teeth, sa mata. So good thing that they are giving also a discount, especially sa mga kababayan natin, di ba?
Tsaka siyempre may mga insurance dyan na i-expire lang.
Hindi nila napapansin, hindi nagagamit. O kaya sa
kailangan natin may time, lalo na kung may insurance ka naman.
Gamitin nyo.
Pwede mo naman i-message lang yung number nito, sabihin mo, we have direct billing with MedLife, NAS, NextCare, Medline.
Wow, ang dami
so,
pala.
Psycho, meron kami yan. So, you can send a message, okay ba itong insurance ko, then we'll send. So, malalaman nyo agad, i-inform namin kayo. And then, malalaman mo agad kung ano yung insurance mo ba, pasok sa amin. So, magagawa yung procedure na hindi nasasayang yung insurance. And
kaya nga
hindi mo babayaan yung take mo. Ang cleaning kasi natin dapat 6 months to 1 year.
6 months, di ba? Tamad nga tayo, kaya sinasabi natin minsan busy. Kaya nga marami sa ating mga Pilipino, wala lang ma-offend. Marami din sa ating mga Pilipino, mga sira yung ngipin. And then pagtanda na natin, doon pa lang natin pinagagawa. Ako, agree naman din ako doon. Kasi nga, sa Pilipinas kasi medyo may kamahalan. Dito medyo magaan.
Dito naman mahal dental. Usually nga may dental coverage ka. Isa pa sa nanonotice po ng mga doktor sa mga kababayan is kapag nga nagpa-cleaning sa amin, kulang na yung mga ngipin. Kasi kahit ako, aminado ako lang. Kasi we don't do root canal. Kasi, so yun nga, mahal ang root canal.
Tsaka masakit.
Masakit. Pero it's a way of trying to save our teeth. Kung napabayaan mo na siya, malalim na yung cavities mo, at least we can save.
Tama.
Hindi mo siya agad bubunutin kasi magagamit mo pa yung ngipin mo how long? Years mo pa gagamitin yun.
Yes. At saka nga yung mga ngipin daw natin, yan ang pinakang matibay na buto sa ating katawan, no? Di ba? Na-research ko yun.
Research ka talaga, ma'am?
Pinakamatibay na buto or parte ng ating katawan yung mga ngipin daw natin. Kasi yung ngipin nga kayang kumila ng trap, di ba? Napapanood nyo ba yun?
Kaya balat ng buko na inyo.
Saan ka ba? O yung iba gagamit ka pa na ano, di ba? Anyways, ayan. So saan na ang mga branches natin, sir? Ayan, mga service dito, anong mga services doon meron?
Dito, kompleto naman po tayo from all. So, we have child specialist.
Wow.
So, may every Thursday nandito ang child specialist natin. So, yung mga bata na usually na may masakit ang ngipin, kasi pinakamahirap ng bata. Pag masakit ang ngipin ng bata, kahit paupuin mo yan sa dental chair, 10 kayo humawak, hindi
yan.
Oh, hindi mo yan magagawa yung treatment kapag yan iyak. Pero meron kami child specialist na kayang-kaya nang i-handle yung kaya niyang makuha yung trust ng bata. So, magagawa yung procedure. And then just in case yung sobrang talaga hindi kaya, meron kami facilities yung inhaler. So, may gas tayo para mapakalma sila. So, magagawa din yung procedure from that. Doon sa child din, we recommend here in our clinic po na yung early braces. So, kapag like 10 to 11 years old, so pwede nang abrasion. Kasi, kapag sa braces kasi agad maaga, meron pa natin, hindi yun na kailangan bunutan ng ngipin.
Oo nga eh, sayang nga eh.
Mostly kasi sa atin, kapag adult ka na, magpapabrace ka, sasabihin sa'yo ng doktor, kailangan bunutan ng ngipin din, hesitant na tayo.
Oo.
So yung mga
sasarpa.
Oo, yun. Sa mga anak natin, hanggat bata kasi, may mga treatment tayo para ma-expand ang jaw, hindi natin kailangan magbunot ng ngipin.
Yun, napakaganda.
So kailangan, yung may anak tayo, may insurance tayo, pa-check up natin, para bigyan natin ng time.
Yes, importante yan. Kasi pag sumasakit ang ngipin natin, sasabihin natin, wala, parang hindi na tayo makakilos. With all honesty, minsan na-absent na tayo. Kasi pag sumakit nga daw yung ngipin, lahat na ng buong katawan ng masakit. Kasi diba, sakit sa ulo, parang wala na.
Parang sakit talaga, hindi ka makakapagtrabaho.
Diba, wala na, absent ka naman. Eh kung ano, prevention is better than cure nga, diba? Kung inuuna natin yung kasi kasuhin, diba? O di, mas maganda.
So, mga nagpapalot ka na, we do have some special pricing for kabayan, and pag nag-reach out tayo, kila ma'am, so we do, recommend nyo ma'am, syempre bigyan natin ng discount. Root canal po, we have root canal specialist. So yung mga root canal namin is sobrang magagaling, like curved canals na sobrang hirap, tough cases. So meron ganon. Siyempre may mga canals siya, iba-iba yan. So mga tough cases, so meron kami noon na gumagawa noon. Meron kami oral surgeon, so yung mga wisdom tooth na impacted. So yung iba ayaw nang galawin yun, so talagang mahirap, so yan, operation na kailangan. Meron din kami na. Sobrang gaan din ang kamay niya, yung mas mabilis ang procedure kapag siya gumawa. Dr. Emma and Dr. Sagar, so marami na na-meet kay Dr. Sagar siguro yung pair nyo. Parehas sila. And then Dr. Hina nga po, yung sa braces namin, Dr. Malika and Dr. Yeah. So, kompleto din po kami. Kompleto kami, may mga veneers kami, Hollywood Smile, laser gum treatment.
Hollywood Smile tayo dyan.
Whitening po, meron.
Yun, kompleto dito sa Clover. Alam nyo na yan, dapat ano. So, yung brush naman natin sa Ticom and sa Burdubay.
Yung brush natin sa Burdubay is malapit sa Burjuman Metro Exit 1. So, may day-to-day side po, diretso lang, malapit sa Major Hospital. So, opposite siya ng Lulu sa Burdubay. Malapit lang din po. And then sa Ticom, bar siya, Clover Medical Center bar siya, malapit sa Grand Millennium Hotel.
Dami din tayong mga kababayan dyan.
Yes, sa may Media Rotana. Sa may Warsan Tower po, nandun lang yung ano natin. Then you can call us, then pero syempre, emphasize ko lang din po na kailangan dito sa clinic namin is appointment.
Appointment.
Except lang kapag syempre masakit ang ngipin.
Emergency
case yun. Pero yung emphasis talaga yung appointments. So tawag kayo kung anong oras kayo pwede. Kasi yung namin, yung kung anong oras ka yung time mo, punta ka ng ganong time kasi next, para magawa kung anong ganong kahaba yung treatment. Kasi sometimes gusto mo, papastahan sa'yo, di ba? Or syempre mas mahabang time. So para alam natin, pag tawag nyo, appointments po important.
Yeah, bigyan natin ng time yung ating mga sarili, yung mga ngipin natin, guys. Importante yan. Ako, parang wala sumasakit sa natin katawan. Masakit na nga yung puso mo sa pagka-broken heart mo. Pati ngipin mo pa sumasakit. Baka kung ano na yan, di ba? So, yung visit lang kayo. Anong telephone number pwede sila
pwede, kung sakasakali po, pwede sila mag-reach out. Kung pwede nila akong i-reach out, sa mga kabayan, so just in case I can have them some offer and then I can refer to which doctor na kailangan nila. They can WhatsApp me at 058-180-4119. So message nyo ako through WhatsApp so I can help you
May initial na nakagad kay sir. No?
Kung anong branch ka pwede, kung anong schedule ng doktor, mas madali ko po kayo matutulungan.
Yes.
So, I can do also some prices na mas mabibigyan ko sa ganang discount. Yeah.
Tama, ayun. So, ano yung madali lang yun, di ba? So, mamaya ilalagay din natin again sa live yung mga telephone number and mga address po ng ating Clover Medical Center para alam nyo kung anong gagawin nyo. So, ayun, may initial na kaagad sa sir, di ba? You can do WhatsApp, so pwede mo na sabihin kung ano yung initial finding mo sa sarili mo, kung anong masakit, di ba? So,
alam mo na. Kasi usually kasi pag punta ka ng consultation, kailangan mo ng ganitong recommendation, time consuming eh.
Umubos pa. At least pagpunta mo doon, i-meet ka na ng doktor.
Limit ka ng tamang doktor para
yes,
sa'yo.
ayan. Tamang doktor, masakit yung puso. Heartache pala.
Heartache.
Akala ngipin. Kung ano-ano nang nararamdaman. Okay, anything else that we can share? Sir Richard, ano pa?
So, welcome po kayo sa ating clinic. So, maraming salamat sa pagsuporta sa mga supporters natin, sa mga partners ng Clover Medical Center.
Yes.
Maraming salamat po sa pagsuporta sa amin.
Ayun, syempre ang Clover Medical Center po talaga kasi nagsusupport po yan sa mga advokasya po ng kape at